My
Hello.
name is Bree Laughlin, and I am a longtime nurse, and I am CEO and founder of Nurse Disrupted. I wanted to come onto Project Pitch It to talk to you about how Wisconsin hospitals, they're hurting. I typically don't have to convince people that there's a nursing shortage, and this is what Wisconsin looks like. We're about 1,400 nurses short. That's compounding the two other problems I'm presenting to you. Because of the staffing constraints, Wisconsin's hospitals are having financing constraints as well. And 22 Wisconsin hospitals and clinics have closed just since last spring. Now, for the hospitals and clinics that have stayed open in Wisconsin, 43% are bleeding money. They're in the red. So the company that I started in 2020, Nurse Disrupted, is a virtual nursing platform. This is where I, as a nurse, can actually work from home. And we are the only telehealth platform on the market that is designed for nurses and for nurses to work from home. And this is special because when nurses can work from home, 85% of us will pick up an extra 4 or more hours every single week. We've lost a lot of nurses to retirement. Nursing is physical, a lot of physical wear and tear, and people have had to retire too early. But when a nurse can practice with a video visit, even with hospitals that are admitted to the hospital, they can come back to the profession that they love. Now also, employee pools for hospitals expand. Nurses want to practice in this way. And so our Wisconsin hospital systems can attract new talent to keep their doors open and to keep costs low. And finally, virtual nursing in the way that we do it at Nurse Disrupted actually generates revenue for hospitals so they can keep their doors open. And the most common time when someone's in a hospital, a patient will wait for care is right before you're going to discharge. And the reason is that you're the healthiest you're going to be. So as a nurse, I have to be passing medications, changing wounds, changing IVs. We're going to start with that story on a day in the life of a hospital that uses our platform. And we'll start off with Chris, who is a nurse, and he has a patient, Jen. And Jen's ready for discharge, and Chris knows Jen has to get home and that there's a patient waiting in the emergency department for Jen's bed, but he has to pass those medications first. He has to answer the call lights, but that's okay because his hospital is using the Nurse Disrupted platform. And you can see Chris using our mobile app. He rolls the Nurse Disrupted mobile app into his patient's room, and with a tap, he connects Jen, the patient, to Maria, who's able to work from home. And Maria is able to get Jen home about an hour earlier than if Chris had to finish all of his other tasks and then complete the discharge in the hospital. For every hour that we save in this way, we're saving the hospitals $13,000. Now, this is critical in the economics of the way hospitals work. Patient satisfaction across demographics is sky high, and the revenue that we're making for our hospitals the ROI is 1,000%, you guys. It really is making a difference. We are live around the nation, but not in my hometown, Madison. And that's why I wanted to talk to you all. We need to have our solution live in Wisconsin, and I'd like your help to connect us to Wisconsin hospitals so that we can make this kind of difference in our home state.
What prompted this?
2020 changed all of our lives. It's not a mistake that March of 2020 is when I launched Nurse Disrupted. I was actually a nurse executive at a large software company, but I was volunteering for one of our homeless shelters in Madison. They went from poor access to healthcare to none. I was an elected official on Wisconsin Nurses Association at the same time, and in the pandemic when we needed the nurses the most, nursing students weren't going to graduate. And so it was a perfect storm. I started with Marian University, students with Marian University and Porchlight Adult Male Shelter in downtown Madison, and launched that first virtual nursing platform. Over 400 nursing students used our platform to graduate, and they provided over 50,000 encounters to people experiencing homelessness. Then in 2022, hospitals started asking us.
I look at this very differently. I looked at this from the legal perspective. Patients, I also fully understand that the vast majority of work done in medical facilities is done by the nurses and the physician's assistants, not so much by the doctors. The question, of course, becomes when you're giving somebody medical advice without seeing them, it becomes somewhat delicate and it's very sensitive. Somebody sometimes needs somebody to talk to, just needs some advice, needs some sensitivity, needs to be told to actually see something.
I hear you. It's been so important. There are things, of course, that I don't do virtually that I do in person as a nurse. So as a nurse, I will listen to your lungs. I will actually look at your skin head to toe. There are specific workflows that are very, very good for virtual care and specifically virtual nursing. And the discharge workflow is a very good example. When I discharge a patient, largely that's education. I'm talking to you about your medications. I'm looking to see if you have the follow-up appointments that are appropriate, which I can coordinate on the computer. All of that is really good dialogue. With our platform, the virtual nurse is working in a hybrid dyad. So there is still that inpatient nurse, but the virtual nurse is lifting the clerical workload largely by way of patient education.
Thank you. That's very reassuring.
I have a question for you. You're the founder here in Wisconsin. Why are you struggling so much here versus, how many other states are you in?
4.
4. What do you think the challenge is?
I think it's a very good question because I've had doors open. I've had health leaders willing to talk, but I'd love your advice and perspective. Maybe we can sit down and talk about it because I've been a little bit puzzled, and I think that's where your expertise and advice can help us break through this barrier that I truly have struggled with on my own. I'd love your help.
Well, this is amazing. Thank you so much.
Okay.
Thank you.
Thank you, everyone.
Thank you.
Thank you.